Welcome, everyone. Thank you for tuning in. This is episode 10 of the Eternal Vitality podcast. I can't believe we've made it to number 10. I've been consistently putting these out each Monday. If this is your first time with me, I am Jesse Morse, a family and sports medicine physician in Miami, and I've been practicing medicine after fellowship for about 5 years now, closer to 6. And I have a passion for fixing issues non-surgically and really addressing the core of the injury of the issue instead of putting a band-aid on it. So I am no longer in what I call traditional medicine, insurance-based medicine, and try to find a more holistic and functional approach to traditional medicine, as well as regenerative, or what we call orthobiologics. Now, this is a very sensitive topic. So that's why I wanted to discuss it, but I wanted to get my feet wet first. This is something I do every day. I am one of the, in my opinion, few specialists in this area. Some people do this, once a week, every couple weeks. This is all I do. I don't do cortisone injections. I don't manage fractures much anymore. No concussions. I treat people non-surgically with a needle, addressing tissues that are injured, and we're looking to make significant positive change in that tissue to allow it to handle the load you're asking it to decrease pain, improve range of motion, and to get rid of that fear that may be paralyzing you from letting you do what some of the things that you want to do. Many people will say, PRP doesn't work. I've been using it for 5 years. My partner's been using it for almost 15. There's no question it works. There's data to support that it works if you look at the right studies. There's a lot of garbage studies out there. As far as stem cells, what are they? We're going to cover it very extensively. You're probably not going to hear a more extensive talk unless you come to my lecture at the Cell Surgical Conference in a couple months. But in general, this is not a topic most people are comfortable talking about because they don't practice it. They don't discuss it in fellowship. They don't discuss it in residency. And there's no book that just covers all of this. This, unfortunately, is experience-based, and you really have to go to a ton of different conferences, speak to a lot of different people, weed out what a lot of the garbage products, understand what you're trying to achieve, and really what the science is behind it. Unfortunately, there's not a ton of huge data like you're seeing in classic ortho or a lot of the pharmaceutical-based industry, because those cost millions and millions of dollars. And this is a product that most of us can get out of ourselves. So I don't see a pharmaceutical company lining up for that. But there are a lot of small studies. There are a lot of retroactive studies that do show this works. And we have countless patients that get better and able to perform at a high level and come back a different month, a different year, still doing well. I had one come back today, a year later, and having no issues whatsoever. That's not a placebo effect. That is real. So, I'm going to step back and kind of give you an idea. If you haven't checked out any of the other podcasts, I try to cover topics that are not traditional, that some doctors may be uncomfortable to talk about, whether it's depression and how you could consider using something like ketamine, whether it's a crazy old school med but amazing med called methylene blue. I cover testosterone. I cover platelet-rich plasma, or PRP, extensively. So each of these, last week, people keep asking me, hey, what are your favorite supplements that you take? So I said, okay, let's make a podcast about it. And that's what I did. If you haven't checked out any of those, I recommend you do so. Find it on Spotify, Apple Podcasts, YouTube. It's on my YouTube channel, my Twitter channel. If you're looking for it, you can find it. If you have a topic that you'd like me to cover, either I will work on researching it or I will find an expert in the area and ideally collaborate with that. We have a lot of cool things coming the rest of 2024, but I would love to know what you guys want to hear about. All right, so what are stem cells? So the term and what we think it is really not what it is. Arnold Kaplan, who's kind of the original guy who made the definition, he initially said, hey, these are these cells that go in and they create all all this beautiful new tissue and can kind of decide whatever it wants to be. And about 10 or 15 years after that original statement, he said, you know what? They're not actually that. They're not mesenchymal stem cells, MSCs. That's not a good name for them. A better fitting name for them is medicinal signaling cells. I like to describe these as the ultimate traffic cop. You come here, hey, this is an injury, go over there and fix it. Hey, you need to go over there and do this. This is coordinating with the stem cells in your tissue, in your heart, in your lungs, in your rotator cuff tendon to start working. If the tissue was going to fix itself, it would have done it already. Obviously, it didn't. The issue with the body is that ligaments and tendons do not have a good blood supply. They do not heal well. I don't care if you're a professional athlete or a regular Joe Schmo that's 50. It doesn't matter. They don't heal. That's why rotator cuff injuries exist. That's why patellar tendon injuries exist. That's why Achilles injuries exist, because the tendon doesn't heal well. It frays, and unfortunately sometimes it tears. You can inject different things into them to stimulate them to be stronger. Dare I say regrow? I don't know if we can comfortably say that yet. But when Arnold Kaplan rephrased this into a medicinal signaling cell, I think that is an appropriate term. A lot of the times when I use the term stem cell, it's because colloquially, that's what lay people know it as. I usually kind of clarify, say, this is more like a signaling cell. This is more like the ultimate traffic cop. This is more a growth factor. At the end of the day, that's all they are. They're very important growth factors in millions and sometimes billions. But that's what you're looking for. You're looking for reducing pain, improving range of motion, stabilizing the ligament or tendon or whatever you're trying to improve, prevent progression of disease if possible, and ideally get that body part to be so much better that you're not afraid of doing something that's going to re-injure it again. No, I don't want to do that, rotate, I don't want to do tennis. I don't want to play basketball because that is going to cause pain and then I'm going to be hurting for a week. So no, I'm not going to do it. My goal is to reinstill confidence in you in that body part so you don't think about it, hey, should I go play? You just go play because you're confident in that body part again. That's what PRP with stem cells, what regenerative medicine has the ability to do. Now, unfortunately, the majority of this is not covered by insurance. That's a separate discussion. TRICARE, which is military-based, does cover PRP for a couple different body parts. I've had some international insurances in the past cover some stem cells, but again, it's not super common. But in general, they are growth factors when put in the right place, when put at the right volume, they can substantially help the tissue. Can you argue that you're going to regenerate cartilage? Probably not. Have I seen a rotator cuff tendon a year later, a year and a half later, after injecting it with a stem cell line, have significant improvement in the ultrasound? Yes, all the time. Whether or not somebody who doesn't experience this and doesn't see this regularly believes that, that's up to them. This is all I do. So literally all of my patients only get regenerative medicine, at least from us. So I have that luxury of being able to use that as experience. A lot of my last practice, my first practice coming out of fellowship, I really only did, any regenerative medicine, predominantly PRP, once a week, once every couple weeks, because it was an add-on. You're trying to push cortisone. You're trying to push gel. You're trying to prep people for surgery because that's what the insurance-based model covers. Just because the insurance-based model doesn't pay for something doesn't mean it doesn't work. It just doesn't mean they don't want to pay for it, So many people ask me, well, what are the different options? I hear about all these different things. What are there? What are the different options? So I'm going to break it down. There's a fork in the road. You have stuff coming from you autografts, and you have stuff not coming from you, donor, allografts. Let's cover autografts first. So PRP, or platelet-rich plasma, coming out of the blood does not have any stem cells in it. Anybody who tells you they do is lying. Now, there's a separate small facet called V cells, VSELS, standing for very small embryonic-like stem cells that you can't technically get out of blood. That is a separate discussion for a separate day. But in general, PRP does not have stem cells in it. Now, the first and most common stem cell line from us is bone marrow. All right, bone marrow is usually taken from the posterior hip, what we call the PSIS. You can get it from other parts. The data is overwhelming that it's best from the PSIS. Now, there's different ways to extract it. It sounds like it's painful. Most people that do it, I probably do one of these a week or every 2 weeks. Most people do fine with these. These are not particularly awful. I've done them on 14-year-olds. I've done them on 7-year-olds. They end up doing fine. Now, in general, it can be a little uncomfortable. These are filled with two different types of quote-unquote stem cells, HSCs, which are what make blood, and MSCs, or medicinal signaling cells, which are what most people consider true stem cells. And then it also has an amazing protein called IRAP. And IRAP is, in my opinion, what kind of makes bone marrow so potent. And if you look at the data, and I'll pull the chart up if I can find it, that as we get older, the stem cells in our bone marrow significantly decline. So as a newborn, the stem cells, or MSCs, in the bone marrow are about 1 in 10,000 cells. By the time we're a teenager, it's already 1 in 100,000 cells. You just went down from 100% to 10% in about 10 to 15 years. By the time you're over 60, it's 1 in 2 million cells. But I've got countless patients that I've injected bone marrow on in their 60s and still did significantly better. So it's obviously not just the MSCs that are doing the job. Now, the beauty of bone marrow is that you get a lot of volume, or you can get a lot of volume, depending on the technique you use. Some doctors do it via needle, what we call a deep needle. I use what we call a Ranfac. And that helps to get the bone marrow on different layers, and it helps to extract the bone marrow, which kind of looks like a honeycomb, and you kind of pull it out, then you extract it, it goes to the next level, you pull it out, so on and so forth. Some people use a drill. I personally believe that this is damaging the bone marrow, so I do not like to use a drill. Then there's other doctors that will actually do a single device. This is a little bit more old school, and just take a little bit out at a time. You can do them on both hips or multiple different spots at once. We did that last week, although that is a lot of volume. Depending on the kit you use, you really should not take more than about 1 to 2 cc's of bone marrow at each site, because you're going to dilute it and you're going to lose that potency. So you really have to know what you're doing. The rate limiting factor for bone marrow is it's quite inflammatory. It is not an acute inflammatory like a PRP. PRP peaks really quickly within 3-4 minutes, and it starts to taper off, and by the next day, it's significantly less. Bone marrow is not that same peak. Bone marrow comes up here and sits for 1, 2, 3 weeks. So any of my professional athletes, none of them want to do bone marrow unless they have months to recover, because especially if they've done it, it works. There's no question it works. They get really good results depending on what they're trying to do. A lot of them don't have the luxury of the timing that it's going to take to do the recovery. But in terms of best bang for your buck, in my opinion, you're not going to get a better one than bone marrow. Just understand that the recovery is a little rough. Now, the other option from us is adipose, fat. Believe it or not, the best mesenchymal stem cells, or MSCs, in the body are actually in the fat. Now, the reason why that is because those fat cells and the stem cells in those fat cells, the only job is to create fat cells. So if you're relatively lean your whole life, your stem cells have basically been chilling. Unlike the stem cells in the bone marrow, which age as we get older, as I just mentioned, adipose, that's not the case. So a 20-year-old adipose cell and a 50-year-old adipose cell basically have the same concentration or age and potency of adipose. Now, when someone says, well, I can do a mini liposuction and get stem cells, okay, now we're talking. And yes, that is very much the case. But when you think of a liposuction, they usually probably take in 1,000, 1,500 cc's of volume, usually from the posterior flank, maybe from the abdomen. When you're doing an adipose procedure for stem cell, you're only taking 200 cc's, 150 cc's, and really you're only getting about 30 cc's of fat, at the most. So the issue with adipose is that you don't get a whole lot of volume, and it takes a while to extract procedure-wise. I can do a bone marrow in 15, 20 minutes. It takes me 45 minutes to an hour to do adipose, depending on the person, depending on where you're getting it from. So it's laborious. But the beauty of adipose is that they're really potent. It's sticky, almost like a graph. And a lot of people will actually mix it with PRP, or you mix it with bone marrow or whatnot. Right? Some people mix all three of them together. Now, these actually have to be spun, because you have to break down, or normally you have to break down. Now, in some states in the United States, you can actually mix an enzyme, usually collagenase, to break that stem cell from the fat cell. Now, unfortunately, I live in Miami, I live in Florida. That is not available in the state, so I don't have the luxury of doing that. That's what we call SVF, and the data and the potency of that product is beautiful. But unfortunately, it's restrictive. Now, there was a time period about 5 to 10 years where this was not available in the United States. Dr. Berman, a plastic surgeon that was in Beverly Hills, he had a company, he passed away, that said, you know what, I'm going to fight the FDA because we believe that this is a legitimate product, that we don't really have to worry about, we're not messing with this product. It's legal. So they fought the FDA. They actually had 5 different counts, and they won all 5 counts. They overturned it, and it was then legalized again almost 2 years ago. So you'll see that. In general, that's the beauty of adipose, is that's the only product that I'm aware of that the FDA actually lost, and they see it and they said, yes, you can do it. But in general, adipose works well, especially on athletes. You can't do it. They don't have enough adipose. It's very uncomfortable to strip fat from an athlete that is lean. You can do it. They're not happy with you. It takes a long time. So unfortunately, it can be very difficult. You start pulling it from underneath the knee, like in the Hoff's fat pad, and it gets kind of silly. It becomes challenging. So one other thing I'll say about bone marrow that I didn't mention earlier. So the difference in bone marrow, some people do what we call whole bone marrow, meaning when you take it out, you don't spin it at all. That's what I do. Some people spin it and make it into a concentrate, what we call BMAC or BMAC, bone marrow aspirate concentrate. Now, it is my opinion, and I've seen conflicting data and just viewpoints, that when you spin it, you lose some of the potency of that bone marrow. So that's why I personally don't do it. I've had good luck, so I'm not going to change it. I could justify if you wanted to do some spun, some whole. Either way, there is a different school of thought depending on if they do whole or bone marrow aspirate concentrate. Okay, so those are the ones coming out of us. PRP coming out of the blood, which does not have any stem cells. Bone marrow and adipose are inflammatory. They create inflammation before you start healing. About 10 to 14 days, a lot of the process is you should not take any ibuprofen, leave any of the anti-inflammatories, because you want to create that inflammation, and taking those is going to knock that down. You have the luxury of your Tylenol, you have the luxury of your narcotics, and then your curcumins and turmerics, and CBD and that type of stuff. But you shouldn't do anything that is anti-inflammatory because it's counterproductive. Now, I've had people say, like, I just had a cortisone shot. How long should I wait in between that? Ideally, 3 months. That may be a little unrealistic. I would say at least 3 weeks. I won't get into the discussion whether or not you should use lidocaine or any of the anesthetics. I'll just say this is an uncomfortable process if you don't use it, especially if you have a really inflammatory product. And ideally, you're trying to limit the interaction with the cartilage and with the ligaments and tendons, because some of the anesthetics can cause some problems. So I personally dilute mine as much as I possibly can so I can get enough of an anesthetic effect where you don't feel that pain, but not enough to really harm the tissue. But let's transition to what we call the allografts. Now, the problem with the allografts is that this is what is quote unquote frowned upon by the FDA. These are products that are available, but it depends on who you ask. They're not quote unquote cleared by certain people, and it really depends on the use. So I'm going to cover these just because it's important to cover these because they are available, and in different parts of the world also have these. So it's important that I discuss them. Just understand that that these sometimes have regulatory issues. There was a huge, what I call sweep about almost 3 years ago, I think it was. Yeah, about 3 years ago, that pulled off almost all of the amniotic products, a lot of the umbilical products off the market because there was a lot of garbage. There was a lot of shady stuff. There was rebranding, putting labels on a different product and selling it. Just a lot of garbage stuff that had a black eye in our industry. And unfortunately, that caused a lot of problems. There were only a couple products that survived. Many of really good products, because of the way they were labeled, because of their designation, they weren't allowed to be sold anymore, and that was it. There was nothing they could do. Now, many of these products are sold and used in the OR by orthopedic surgery or by different types of surgery. Some of these amniotic tissue products and some of the other products are sold in like a sheet or like a little piece, we'll call it, a little mesh, and maybe they'll wrap an Achilles tendon with it or something like that. So understand that these are used in a different capacity, and they have that availability. So the first one I'll talk about is an amniotic tissue allograft. So this is an actual tissue. This is taken from a scheduled C-section traditionally. Mom and baby gets delivered. Normally, placenta and amniotic sac get thrown away. This time, they get donated. So when they get donated, they get screened and evaluated as if you were donating an organ. Everything under the sun, test-wise, they check for. If it passes inspection, it then gets evaluated, and it will be micronized into 1 cc or small increments, and then usually flash frozen, or sometimes they have ambient temperature products. Now, there's not many companies that do this. These are very expensive, and these actually have a tissue in them. They have to be small enough, micronized enough to get through a needle, so you're not going to see a big sheet in these. But the way I like to think of these is almost working like a scaffolding. You're going in, the tissue is in there, it's not moving anywhere, it's very big, it's visible by the naked eye. You go in, and now you start building on top of this. And the body has all of these growth factors. So I don't like to call these stem cell products. These are growth factors. That's the way I utilize. That's the way I describe these, because that's really what they are. What they're doing is they're delivering millions and probably billions in some capacity of different cytokines, different growth factors that they were just using to make a baby, to make all the different organs, to provide nutrition to the baby. Now they're being reutilized into a rotator cuff, into a knee, into an Achilles, or wherever they're being put. So that kind of gives you a gauge. If I had to guess, this is what a lot of the professional athletes use. Why do they use them? They're super potent and they're not inflammatory. Within 3 to 4 days, there is a decrease in pain. as opposed to something like a PRP or a bone marrow or an adipose where there's an uptick in pain for several weeks. These are anti-inflammatory. They work very quickly. So if you're trying to return to the field quickly, you can't do a PRP. It's too painful. You can't do a bone marrow. It's too painful and inflammatory. You almost have to use an allograft product if you're going to want to get that result. Okay, let's move on to a different version, a similar product, one that instead of using the tissue with the amniotic, you're just using the fluid. Now, the theory is very similar, but in my opinion, you're going to lose that grafting effect because you don't have the actual tissue in there to stabilize it. You're just utilizing the growth factors that are floating around in that fluid. So I believe these are probably pretty potent. It may depend on the brand. It may depend on how they extract it. But in general, they probably have a lot of potency. Now, they're probably ones that have both fluid and tissue. I wouldn't be surprised if that existed. It makes sense. The next line is a little bit of a controversial topic. These are umbilical cord. So a lot of people will call them Wharton's jelly. Now, umbilical cord, which obviously is cord between baby and mom. If you do look at the research and you do a deep dive, out of that entire cord, there's only about 5% of that cord that has true viable stem cells in it. The problem is that most of these companies that are probably doing this are getting the entire 100% because it's a very expensive product to extract, very hard to get. It has to go through a lot of processes to evaluate it. So they want to optimize it. The problem is if you're only getting 5%, then that 5%, you have to get a lot of quote unquote samples or donors in order to really make a product. So the issue that I've seen or heard with these is that I don't like these, is that the issue with these is that sometimes, especially if you do them IV, which is really a big no-no here for this specific product, is that people have issues with these because for whatever reason, their body can react with these. They can freak out a little bit. Whether it's a protein that the body didn't recognize or something along those lines. So these you have to be careful with. Some people are adamant that these work. I don't know. All I'll say is I think they have more red flags than they're worth. And in that regard, and in the odds that they're using only the 5% is very unlikely. So if you're comparing them to a different allograph line, they're not going to be as strong, in my opinion, because of the source that it came out of. Now, there's a relatively new kid on the block, just came out this year that I'm aware of, that is a fat-based and adipose-based graft. So it's donors from probably 20 to 35-ish year old men and women that are super healthy, super lean, that have good fat, a little bit of fat, but not a whole lot of fat, that donate. They get cleaned, they get checked out from my understanding, and once they do that, they strip the adipose MSCs and they micronize them. And you can have 250,000 stem cells. Depends on the vial size. They have 500,000. There's probably there's a 2 million count one, and there may be multiple brands. I know of one of the brands. The one that I'm aware of is liquid. It is not a tissue-based graft. It is liquid, but I understand the science behind it, and I can definitely understand how it would be potent and how what they're trying to do, because they basically purified adipose and they made it pure, right? So I think this product has a chance to be FDA approved eventually and probably covered by insurance. We're a long ways from there, but I think if there's a product that is an allograft product, I think this is probably it that will get covered based on the fact that the FDA lost that case, based on just the data behind adipose and whatnot, and based on that it's less controversial, at least in my opinion, than the amniotics, than the umbilicals. And the final one is definitely a sensitive topic. It's about probably 10 years old now, maybe a little bit older than that. And these are exosomes. Now, you can get exosomes from many different locations. These are traditionally placental-based exosomes. So think of going inside of a placental tissue, the placenta. You go inside of the placental stem cell, or the MSC, and think of that stem cell as saying, hey, there's an injury over there. I need you to go fix it. I'm going to put all these growth factors in this protein, and the protein is going to go over there and release all these growth factors, almost like a carrier protein. That's what an exosome is. It is that carrier protein with all of these growth factors. Billions, some people will argue trillions. Now, it's not originally trillions, but when you extract it out, clean it, purify it, and then multiply it, you can get very, very high volumes of these. Now, there was a research trial with these for COVID. And it was ongoing for that. There's a couple companies that have these available. These are predominantly for aesthetics, facial products, hair, that type of stuff. And I've seen videos of someone named Kim Kardashian using these on their face. So they do exist. You can use them, or people are using them, I should say. Some people will do what we call a microneedling procedure, where they'll actually, there's a little needle that has about 11 little needles in it, and it goes down, and it basically creates a little abrasion in the skin, and then you basically rub the exosome into that. And basically what it does is it helps to tighten up that skin, and it can help to regenerate or replenish, I wouldn't say regenerate, the cartilage and some of the tissues in that area. At least my understanding, that's probably how it works. Now, I think these have a lot of promise. These are really small. I'm talking like virus level small, which means they can cross the blood-brain barrier. I wouldn't be surprised if we're starting to use these for Alzheimer's disease, for Parkinson's, for concussions, for neurological diseases. There are many, many different things that these have the potential to help. There needs to be a lot more data involved, but in general, these are being used. I can speak to that because I know about it, especially throughout the world, because people see the value in these exosomes. Now, obviously, the sourcing and the quality and the purity is a separate discussion. That needs to be almost perfect, and that's why some of the products that exist that may or may not have helped Aaron Rodgers with his Achilles tear from word on the grapevine. There are different companies that exist that can help with this and create this. To my knowledge, there's some that are better than others. I'll leave it at that. So each of these allographic products, unlike the ones from us, are anti-inflammatory. They do not create any inflammation. The needle going in the skin obviously creates inflammation, so you have a little bit of that. But the actual product itself is not traditionally inflammatory. So you get almost an immediate benefit of pain relief. And then if it has the potency to be able to stabilize that tissue, you make significant progress. Now, some people will mix these with PRP or bone marrow or whatever, and you could, hypothetically, you can mix and match these to get the best of both worlds in terms of growth factors and stabilizing factors. Okay, we're going to finish up strong. So what is the difference between PRP and stem cells? So I use the term stem cells just because it's easy to remember. Orthobiologics is probably the correct phrase if you're going to use it. PRP, depending on what we call kit, and if you haven't watched that episode, I'd probably recommend you go back and watch it because it is a lot more complicated than people give it out to be. And most people really aren't really comfortable in the area because of their limited knowledge in that area. But in general, PRP is probably about a 3 out of 10 in potency. It's not meant to be super potent. It's very inflammatory. And for mild to moderate injuries, PRP can help. Most of the time, you're going to have to do up to 3 rounds, which is not uncommon for PRP. Now, stem cell lines, in my opinion, are about 3 to 4 times stronger. That's what the data shows. Stronger than the PRP lines. So you're looking at a 7, 8, 9 out of 10 potency. So when you're looking like what what types of tissue in the body need stem cells, and PRP is just not enough. The only one, in my opinion, there's a couple in particular. The most common one is the labrum, whether it's the shoulder or the hip. The labrum does not respond well to just PRP. It's very stubborn, and it just doesn't do it. Now, there are other tissues, areas that really struggle to heal, and especially tendons, especially if it's a partial tear or a really bad tear. So you will make progress with PRP, but you'll make significantly more progress with stem cells. A lot of people do not want to do 3 rounds, wait weeks and weeks to fix, quote unquote, fix a problem. They would rather do it once. And sometimes you have that luxury with a stem cell line. Now, the last topic I'm going to cover is the United States versus the rest of the world. So many of you have probably heard about Panama clinics and Mexico clinics and Colombia and Costa Rica and Antigua and the Caymans. Now, each of these has a different regulation than the United States. Obviously, they're not within the the continental 50, so they don't have the same rules, and that's part of the reason why they're there. They have the luxury of kind of doing whatever they want, which is good and very bad. Now, I can speak to a couple of them because I've spoken with their reps. I know what they do and don't do. I wouldn't be surprised if it's a lot shadier than you'd like to give it credit for. What you need to understand is that most of them are using stem cells, usually probably amniotic tissue or umbilical cells that are taken from a donor. We don't know how that donor was acquired. We don't know if that donor was safe. We have no idea. It could be from anywhere in the world. You don't know anything about that donor. The other issue with it, because they're not FDA cleared, you don't know how much what they call multiplied these cells. So when they get them out, say they have 1 million cells to start, but they're like, hey, these cells are expensive. I'm going to make 10 million. So they multiply it and they basically replicate it 10 times. Well, the data shows after about the 4th round of replication, some of those cells become unstable and they're making it less potent usually. So, around the 7th or 8th round, you might start seeing cells that are inherently unstable. And who's to say that some of those cells can't become cancerous, are so unstable that we don't know what they're going to become, or they lead to something 5-10 years down the road. That's the issue with many of these clinics around the world that are not US based. And when patients call or ask me in person, hey, what's the difference? This is what I tell them. I said, you really can't control what's in those cells. And most of the time, they put a little bit in the joint or in the area of the tissue. And their techniques are not very good, usually injection-wise. They're not going to do a super comprehensive injection style like I do. But they put a lot of them into the IV. They pump you full of them. Of course you're going to feel better. These are a massive anti-inflammatory effect. They're going to your liver, your brain, your heart, everywhere. You name it. Within 30 seconds, they're all over your body. So of course you're going to feel better. The problem is you need those tissues, you need those products directly where that injury is. So if that's what you're trying to do, put it where the injury is. If you want it in the rest of your body, then get them IV. But understand that there's a lot of risk involved in these. So that's the rate limiting factor for many of these clinics. And that's why they can't practice in America, because they're not allowed. What they do is illegal here. So that's, just understand that's, in my opinion, the difference for them. Hopefully you found this lecture helpful. You can tell that it's a passionate area of mine. I've been doing this for a while. I feel like this is the future of medicine. Stem cells, quote unquote, stem cells are legal in the United States. Price range, this is what we call a sensitive topic. I've seen them as cheap as $2,500. I've seen them $100,000 in Canada. So, it really depends on source. It depends on volume. It depends on expertise. If you have a clinic in Montana, they're probably going to be cheaper than a clinic in LA or a clinic in Miami or a clinic in downtown Manhattan. Think about it, So where, and if you think about it, almost every single professional athlete I've ever met, and I see them pretty regularly, has had stem cells. So all of your favorite athletes get back on the court for one reason. A, they're genetic freaks, but most of the time they have advancements in medicine that most of us aren't aware of. I'm in the know, so I happen to know. But that's what I'm trying to share with you. Just because big pharma and big insurance doesn't pay for it, it doesn't create it, doesn't mean they don't exist, and doesn't mean people don't use them all the time. They just don't want to talk about it. And that's okay. But I want to share information so that it provides information to you. Hopefully you found that helpful. I'll be creating a ton of new content. Again, if you wouldn't mind, do me a favor, leave a review. Tell me what you think of the podcast. Share some insight on any of the different pages that I have, so I know what you think. Was this helpful? Did you learn from this? What would you like to hear about? Thank you very much. We'll see you next week.